Hello, today we are going to learn Module 3, which is Lesson 5 on our mental health book. It's about suicide prevention. What's suicide? Suicide is the act of taking one's own life voluntarily or intentionally. As you can see here, the guy's trying to take his life away. Suicide is a serious public health problem that causes immeasurable pain, suffering, and loss to individuals, families, and communities nationwide. Every suicide attempt affects other individuals. Family members, friends, co-workers suffers from long-lasting consequences of suicidal behaviors. Suicide is a subject of shame for many people because of the stigma that still exists concerning mental disorders. Many people who need help do not seek it. It's very hard to treat families who are suffering from the consequence of suicide. They think that there is a stigma attached to it. He's lazy, he does that, that's what he does. They don't consider that suicide is mental illness, and many people they don't like to talk about it, so they get suffered inside, and the consequence they will fall on it. It's not good. Suicide, it can be prevented. Suicide can be prevented. Professional interventions from mental health professionals are frequently needed. The caregiver is the first person to know if the individual is thinking about suicide. Identifying a person with suicidal thoughts and connecting with the need help can be successfully prevent tragedy. So it's the first job is a caregiver job to prevent this. We have a very big responsibility. We are saving lives here. On September 10 to 16, 2023, there's a National Suicide Prevention Week. This is a time that we think about preventing suicide, and we pass the week thinking about them. Let's talk about some facts about suicide. Every year, like 45,979, it's about 46,000 Americans die by suicide. The ratio of suicide is higher in middle age, white men in particular. Men die by suicide 3.9 times more often than women, but females are 1.8 more likely to attempt suicide than males. In 2020, the highest suicide rate was among adults 85 years or older. The second highest rate occurred in adults between 75 to 84 years of age. The ratio of suicide attempt to suicide deaths in youth is estimated to about 25 to 1 compared to 4 to 1 in elderly. When you look at the ratios, it's very scary that a lot of people are dying. What leads to suicide? As you can see here, this looks like a lot of drugs and alcohol, and the guy is drinking it, and all this is in his brain. Suicide, substance use disorder is one of the leading cause that can bring suicide. But there are a lot of factors around it too. There's no single path that leads to suicide. Suicide is a complex outcome that includes family, peers, social life, culture, economic or physical environment, and it has a combination factors such as mental disorder, substance use disorder, painful loss exposure to violence or social isolation, and more. Suicide is more common when stress is greater than individual abilities to cope with mental disorders. Untreated conditions like depression, anxiety, and substance use problems may increase the risk of suicide. There's some warning signs we're gonna look at here. Caregivers need to pay attention to what individuals with mental health illness say, like, um, I'm burnout, I feel trapped, or I have like unbearable pain, or I have no reason to live, or all those things. They are like a sign, they are like a sign that person is going to suicide. So it's good to report it to the provider, or who's taking care of that person, to get more help. Any caregivers need to pay attention to what the individual with mental health do. What do they do? Like, are they using substance use a lot? Are they looking for a way to end their life? Are they acting recklessly? Are they withdrawing from friends or social activities? Are they isolating from family and friends? Are they sleeping too much or too little? Or are they visiting or calling people to say goodbye? Are they giving away prized possessions or possessions, or are they aggressive? Caregivers need to observe. This is a big responsibility. And caregivers also, it's good if they can catch the bad feeling the client with mental disorders, like depression, loss of interest, rage, irritability, humiliation, anxiety, worthless, empty, lacking purpose, trapped, alone, hopeless, anger, and mood change. There are a lot of risk factors for suicide. As you can see here, there are some, physical factors, history of substance abuse, uh, previous suicide attempts, relationship problems, access to harmful means, days, family members, close friends, mental health conditions, bullying, exposure behaviors. There's a lot of factors. Just to mention them here, let's talk about health. Health risk factors are like mental disorders, substance use disorders, serious or chronic health conditions or pain, emotional instability, poor coping skills, introversion, sensory impairment, functional impairment. These are like some of them. Environmental risk factors are like stressful life events, which are death, divorce, financial or legal difficulties, or can be relocation, uh, or job loss. Or environmental factors can be prolonged stress like harassment, bullying, relationship problems, unemployment, access to lethal means like firearms and drugs, exposure to another person's suicide, previous suicide attempt, or a family history of suicide attempt, like that. So, in all, just a lot of factors, but these are some to mention. A previous suicide attempt is a known predicator of the suicide. If someone tried it once, they can try it again and again. So those are like a big risk factor. So it's okay to talk about suicide. It's good to talk about suicide. It will help for those people. If you think that someone is thinking about suicide, assume that you are the one who will reach out. You are the one who need to help this person. Maybe that person shows a symptom, you are the first one to see, but you are the one who should reach out about that person. So tips, let's talk about some tips. Talk to them in private. Listen to their story. Tell them you are there with them. Ask directly if they are thinking about suicide. Ask what has helped them before when they had suicidal thoughts. Encourage them to seek treatment or to contact a doctor or therapist. All these things, talking really helps for suicide. So when you are talking with the clients, some things that you need to avoid are like, you need to avoid debating the value of life. You tell them life is too precious. Why you try that? that doesn't make sense for them. And minimizing their problem, it's so bad. That doesn't help at all. Or giving advice, if I were you, I wouldn't this, I wouldn't do this, I would do that, I would do that. That, these people are depressed and they are on the verge, so those things don't work. What you can do: monitor for safety, observe. If you see something, notify the doctor. Take any threat of suicide seriously and stay with the person if you have to. Be aware of the risk factors for suicide. Help them remove lethal means like knife. Create a safe environment to talk about suicide. Create a crisis or risk management plan before a crisis occurs. If a crisis occurs, call 911. If necessary, if the person is in danger attempting to kill, you have to call that one. And there's another, call 988 or suicide crisis number. This is the suicide crisis number. You can chat with a lifeline. Or 988 or the 800 number, 1-800-273-8255. They both are the same. They work the same. Treatment for the suicidal individual. What do we do for them? What's the treatment? A suicide individual may require hospitalization to keep them safe. Usually, if someone is suicidal, we need to send them to the hospital. A suicide person may have thoughts of wishing they were dead, but not have a plan to harm themselves. But just because they say they are suicidal, we need to be aware and we need to send them out if we are afraid they can do suicide. So let's say no matter what we do doesn't work. So the person attempts, he did suicide already and he's gone. So what do we do after? After suicide, we have to call 911 because suicide is considered a natural death. So the authorities or the police are required to investigate. As part of the investigation, the police will want to question you. You should cooperate with them. You must also notify the department and notify your supervisor immediately. You must notify the Complaint Resolution Unit, CRU, hotline. The 1-800-562-6078 is a hotline. So resources for lost survivors. Okay, that person is gone. So how about the families that are left behind? So those people, they need support. So we need to tell them you are not alone, and we have to help them. They can go to the internet. They can search for survivor, for support group. There's a lot of people who can do the group talking. That helps for the person. Schedule time with the suicide bereavement trained clinician. The clinicians can do the therapy too. And you always, it's good to talk about it with the person who lost. They shouldn't be ashamed. Help them with that, and encourage them to seek help if they are falling depressed or having suicidal thoughts. We are always here to help you, and there are effective treatments to help people out there. So be there for the families or for the person who lost. So suicide is not the best way to go. If someone wants to die with dignity, there is a law. It's Medicaid in dying. In Washington have the right to a full range of options for care at the end of life, including Medicaid dying. Medicaid in dying is a practice in which a physician provides a competent adult with a terminal illness with a prescription for lethal dose of a drug at the request of the patient. which the patient intends to use to end his or her life. There are 10 states in Washington they allow to do that. Okay, grief support. So a person lost a family because of suicide. Now the person is grieving. How do we support them? Grief is a universal instinct-based response to loss. When you lose someone, you feel grief. Grief is emotional. It can be physical. It can be cognitive. It can be behavioral, social, philosophical. It can be different things. Can be overwhelming, and you might experience a range of unexpected emotions. Having support of other people is vital to the healing from the loss. Express your feeling to others when you are grieving. Do not isolate yourself. You need to have someone next to you all the time. Don't be depressed like that. So see the bright side of it. So ways to cope. How do we cope? People who lose their loved ones. How do they cope? They need to be patient to yourself. The person who lost need to be patient. Allow self all the time. The need all the time you need to grieve. Face your feeling. Unresolved grief can lead to complications such as depression, anxiety, substance use disorder, and health conditions. Seek out people who are willing to listen when you need to talk or who understand your experiences. Turn to friends and family members. Make health choices in eating, exercise, and get plenty of rest. Draw comfort from your faith if you follow religion. When to seek professional help. You need to find a professional help. You see, over here, a professional is helping. When you feel like life is not worth living, or if you wish you had died with an individual, or if you blame yourself for the loss or failing to prevent it, or if you feel numb and disconnected from others for more than a few weeks, or if you are having difficulty trusting others since the loss, or if you are unable to perform your normal daily activities. National and state guide suicide and crisis hotline is there, which is 988 Suicide Crisis Lifeline. 988 Suicide and Crisis Lifeline provide 24/7 free and confidential text and voice support for people in distress, prevention and crisis, resources for your loved ones, and best practices for professionals. Thank you very much. These are the references that I used. We covered suicide today. Thank you.